Welcome to Casey Cares. We're the voice of Kansas City nonprofits. We share the stories of local nonprofits and the individuals who drive them. At Casey Cares, we're the connection to the nonprofit and business sectors, hoping to enhance the quality of life in Kansas City with its residents and its visitors. This Casey Cares segment is brought to you by the Ewing Marion Kaufman Foundation, www.kaufman.org. I'm Ruth Baum-Biggis. Caring for children's health can feel overwhelming, especially for families without the financial resources to get the care that they need. That's why, back in 1995, the First Hand Foundation was created by the Cerner Corporation as a way to bridge that gap. Through community partnerships and individual grants, the foundation helped children access vital medical care. Well, fast forward to today, and one powerful word comes to mind: change. With Cerner's acquisition by Oracle, the foundation has now taken an exciting step. It's officially become an independent organization. So what does this shift mean? To walk us through this new chapter and share what's ahead, we're joined by the foundation's new president, Mollie Robinson. Mollie, welcome to Casey Cares.
Thank you so much for having me, Ruth. It's great to be here and great to be able to share the firsthand story with you all.
So much to uncover here. All right, well, so everybody in Kansas City and beyond knows Cerner. Cerner has gone through lots of change, became Oracle. So, okay, so what did that mean for First Hand Foundation?
Sure. So just to give a little background, Cerner was established in 1979. And then in 1995, Cliff Illig, Neil Patterson, and his wife, Jean Patterson, decided that there should be a charitable outgrowth of the work. So that's when they decided that we would establish First Hand Foundation in order to ensure the business was aligned with their philanthropic mission as well. So it really was kind of to meet the intersection of healthcare and philanthropy and provide a way for associates to give back to their through their company to their community. And so First Hand was established, and our North Star has always been individual medical grants for children. And so we have been doing that over the last 30 years. We've been providing individual medical grants to children across the globe. And we've given over $20 million away in individual grants.
Wow.
Yes, we're very proud of that work. And then in the early 2020, Cerner was being positioned for a sale, and we were acquired by Oracle. And a lot of our work got absorbed into the larger social impact space of Oracle. And the foundation was absorbed. And so early last summer, so in 2024, I was approached by the Patterson siblings. So Neil and Jean's 4 adult children decided they wanted to really pay tribute to their parents' legacy and reignite First Hand, really giving back to the Kansas City community and just really returning to the roots of providing grants to individual children to access medical care. And so we began the work last summer. I came over and we began standing up the foundation, applying for our 501c3 status, and standing up our grant application. And so through our agreement with Oracle, we were not able to use the First Hand name until this July. So we were doing a lot of things under wraps, and it's been challenging, and I'm sure your audience can relate, fundraising and getting our name out without being able to use the name. We threw a launch party 2 days after we were able to legally use the name. So just really doing things incognito, which was kind of fun, giving a lot of nods to some old Cerner, the handprint, the iconic First Hand teal handprint. Just really were, kind of nods to the things that we were doing, really trying to engage some former donors and a lot of former Cerner associates who really had been so invested in the work through, their own work at Cerner. So we, had a little launch party last 2 weeks ago, and it was on Jean Patterson's birthday. So in honor of her 67th birthday, we were able to reignite this foundation that meant so much to her and really just, return to the roots of the original mission of providing grants to individual child, one child at a time, is really our work. Getting to know families as they step through the medical process and really being able to support the family through their journey. And really looking at each case individually and examining from, the top down how we can best provide support to each family. So that's how we got here. We reestablished in our So we raised $250,000 our first week, and we're able to give our first,
Wow.
we put our first 20 checks in the mail on Monday for individual children who needed grants. So we've already got $85,000 out the door, and we've only been able to use the name since July 10th. It's work that we're extremely proud of.
That's amazing. But
Thank
I
you.
do want to know more about this clandestine time period. That's so fascinating. So you moved over to quote unquote this incognito foundation. Tell us how you did that, man. What was behind the scenes to do that and still keep it under wraps?
Okay, so we have a really interesting relationship with the Patterson Family Foundation. So the Patterson Family Foundation is an endowed foundation, and they are really focused on the rural communities of Oklahoma, Kansas, and Missouri. So they have a very specific catchment and a very specific mission, like all foundations should, right? They're very mission focused. And so they are operating here out of Kansas City, and they have a small legacy grant program. And so what we have decided to do is, so we were working out of the Patterson Family Office, which is now First Hand's office and Patterson Family Foundation office. And so we had been working, kind of sharing resources. But they have a small legacy grant program. And so they've been giving outside of the rural community to different organizations that really meant a lot to Neil and Jean. So OSU, where Neil graduated from, Avila, just some specific organizations. And so the family decided that First Hand was one of those legacy organizations. So we have a very unique model, and we really wanted to emulate the model that we had at Cerner. So part of the model we had at Cerner was for Cerner to cover all of our costs, overhead. And so every dollar that was being given by associates or business partners was going directly to the cause. And we really feel like that's such a compelling opportunity to engage donors, right? It's a very unique opportunity. And so the Pattersons really wanted to do that again. And so the Patterson Family Foundation has been supporting us through a legacy grant and covering our overhead over the last year so that we were able to stand up the foundation and really kind of get things going, have an operating space, have some dollars to use while we were fundraising and standing up the organization. And so while we were doing that, we really were talking about how can we continue this forward so donors know exactly where their dollars are going, and we can continue to build the trust that we have for so long with our donor base. And so we have decided that for as long as it makes sense, if I turn out to be an amazing fundraiser and raise $80 million this year, I'm not sure that it'll make sense. But while we're standing up, and for as long as we can, the foreseeable future, the Patterson Family Foundation will cover our overhead. We'll share some resources. That way our dollars, so we can operate leanly, so donor dollars go directly to the cause. So over the last year, we have been operating side by side with the Patterson Family Foundation. We are a completely separate 501c3. And so really having that opportunity again to kind of make sure that what we stand up and we're ready to go in July was the exact mission, really returning to the roots. And again, being able to operate with a lean team so that we can make the dollars, stretch the dollars as far as we can to ensure more children get medical care. But to go back to your original question about the clandestine, the operations, we really, okay, so a couple of things. The family, I guess, is the best way to call it. If you worked at Cerner and you worked there for any period of time, a lot of people joke, you drank the Kool-Aid, or, we really are just like a tight knit group of people that shared a very wonderful experience at Cerner. And so really being able to return to that donor base and share some of the work that we were planning to do using that handprint that we've been using for so long, and sharing, there's some Cerner Facebook groups that we were able to hop on and just kind of get the excitement going and, look what's ahead. We're writing a new chapter, and just some, little nods to the fun things that we had coming without actually using the name. So I will also say, I would give a shout out to our friends at Global Prairie here in Kansas City who helped us with our relaunch of our brand and developed some really meaningful nods to Cerner and to Neil and Jean, but created this lovely handprint logo again that's different but similar, so people were able to recognize it and really help get the message out before we could use the name. So it was an interesting and kind of a fun ride to try to fundraise and get excitement going without even having a name to use. So it's been a journey. It's been a journey.
Well, congratulations to you on relaunching and raising money, and how great to have your overhead and administrative costs covered. That's such a gift for a nonprofit.
It is. We really feel fortunate. And I can't say enough about the generosity of the Patterson family and the Patterson Family Foundation to allow us to have this operating model, which I think is, again, is so rare and unique when you're not associated, pulling back and not being associated with a corporation was an interesting, kind of conundrum. We were talking about, we had this very captive donor base when we were at Cerner. We had the company who was donating a lot of their CSR dollars, their charitable giving dollars, back to the foundation. And would we be able to support the same level of giving to individual children that we had in the past without the company behind us? And we really felt like, again, with the old Cerner crew, who was really, our first donors, and we're very excited to come back into the fold of firsthand. That's been such a gift. But really, the overhead covering is I think just a fortunate gift that we have been given.
So you're independent. You're not under that umbrella or, the big brother, let's say, in a positive way.
Correct.
How are you going about then trying to, quote unquote, recapture some of those folks who drank the Kool-Aid and were very familiar? Because you can't dip into Oracle, and use that.
Correct. Yeah, we're completely independent. And so, Kansas City is a very charitable city. And there's a lot of great foundations to give your money to. And so, again, we really wanted to make sure that we were being respectful of where people had decided to give their money. As when the foundation took a pause, we haven't been fundraising for over 5 years with the Firsthand name. And so we know that people really had found different outlets for their charitable giving. And so, I think I've really wanted to approach this, Ruth, with the lens of, hey, we want you to consider us when you're thinking about your gifts. And we also want you to consider us when you're thinking about your long-term gifts. So, if this year you've already done your planned giving, we want to be respectful of that, but we also really want to have I think a very a grassroots approach to the grassroots of the Cerner organization, right? So I think, just approaching folks and sharing what we're doing, sharing that we want to get $1 million, $1.2 million out the door by the end of 2025, bringing back the trust and the transparency of the gifts that we are given and allowing people to see exactly where their dollars are going, I think has really been the best way for us to re-engage donors. I'll also say that we have something we call the Clinical Decision Committee, and we've had it forever at Cerner. It was started in 1995. And the point of the committee had always been to allow donors to be good stewards of their dollars along with the other donor dollars and decide how we were going to allocate the grant dollars. And so we meet monthly and we present all of the children's cases and we advocate on their behalf. And then the committee makes the decisions on how to allocate dollars. So when we were reimagining what we were going to do, the Clinical Decision Committee came up, and we restarted with a small group of former associates. And I will say we have had so much outreach of people who had served on the committee in the last 30 years, wanting to know how to come back and how to rejoin. And I think little things like that give donors a hands-on experience really are so meaningful. And I think, again, just the transparency of, you seeing exactly what comes in and then you making the decisions on exactly how it goes out has really also been, I think, a great catalyst for us to get people excited and engaged again. So the committee is something special that we've always had. And I think bringing it back was also a good move for us for donor engagement.
Now, as you became independent, did you have to redo the entire board?
We did. We did. So we are, our goal is to be a public charity. So we have, 60 months to meet the public charity test. So we are fundraising. And with the Patterson Family Foundation grant, it complicates things, right? So we have to make sure that we're doing our appropriate fundraising to ensure that we can meet the public charity status. But so we have the four Patterson siblings, the adult children on our board. And then we also have 6 former Cerner. Most of them are Cerner alum, but a few are not. So yeah, we have our board is larger, but we have a similar board to the Patterson Family Foundation with some public folks on, so that we can meet that public charity test. So we did reestablish an entire board. Only one of the siblings in the past had sat on the board when we were under Cerner, Courtney, and she was the one that was really spearheading this reignitement. So she's been really the one that, along obviously with the support of her siblings, but has really been the one that's brought this to life. And it's been an honor to work with her, and she has some great experience that she's brought on. And so that, with a few former board members as well, some former C-suite executives are also joining us. So it's just been a fun way to re-engage lots of people who have really, always been behind such a great cause.
We're talking with Mollie Robinson. She is the new president of the recently taken out of the wraps Firsthand Foundation. I want to dive into mission now. Yes. A little bit, and let's talk about you give grants to children for medical things.
We do.
Let's dive in. So how do people find you, and what kinds of things are you giving money away for?
Okay, so you can find us at www.firsthandfoundation.org. You can apply for a grant there, but we provide grants for funding any medical necessity. So we will provide a grant for something as small as eyeglasses, to dental work, to open heart surgeries, durable medical equipment. We provide wheelchairs, orthotics, really anything that's considered a medical necessity. We provide funding for physical therapy, occupational therapy. We're really seeing a lot of gaps from what insurance covers to what children are actually prescribed and need. So we're able to fill that gap. If insurance is only covering 30 sessions of PT a year and you need a PT session every week, we can cover that gap of 20 sessions. Really, we provide funding for transportation to and from treatment, if that is your burden or your barrier. Really, we're here to remove roadblocks to medical care. So if you tell us that you have a medical necessity and you have a letter of medical necessity from your provider, you meet our financial guidelines, we're going to do what we can to ensure that you get a grant to meet your medical needs. We provide funding for children under the age of 18, but through 21 if they are reliant on their family for their activities of daily living. So we will extend that grant to the age of 21. And we really just try to partner with just local organizations, Ability KC, Children's Mercy, just, lots of local organizations, Ronald McDonald House. We provide charitable housing funds. So really, just what the patient needs is where we're, trying to meet them. So those are the things that we give funding for. But we also, I have to share that in August, we will be launching our first request for proposals, making $250,000 available to grassroots pediatric health organizations right here in Kansas City. We want to support innovative local solutions that expand access to care for kids. So we're really excited to launch our first RFP. We under the Cerner umbrella, we did a lot of golf tournaments and support for different organizations in the city. And I think this really feels like it's more mission focused. Really keeping us in line, with that North Star of providing access to individual children. We think this will expand that and create bolder, brighter partnerships with our community partners here in Kansas City. So we're really excited to share that. And then we're also reigniting our Love Bag program. So we are going to invite volunteers to assemble care packages filled with personal necessities for children entering the foster care system. This was always something that we loved to do at Cerner because it was such a great way to engage associates to volunteer. And so we're going to reignite that and make bags available to our partners here in Kansas City serving foster care, children entering the foster care system. And so, we're really excited. And those bags also will stay right here in Kansas City, ensuring that our volunteers can make a local and immediate impact. So we've got lots of things cooking over here, and we're so excited. But I have to say, we are, I think being independent really gives us the opportunity to stay very mission focused. I think when you're under the corporate umbrella, there's a lot of easy ways to get pulled. And I think that, you have, someone who has a heart for this or that, and, let's sponsor this golf tournament versus that. And I think this really, again, helps us ensure that donor dollars are going exactly to what people donate to, and that is access to care for individual children. And so, I think that it's just really helping us keep that North Star of mission focus. And I think I keep coming back to that because it was easy to get pulled in different directions working under the corporate umbrella. And it really allows us to make sure that we're not deviating from that. So it's been I think a change and a breath of fresh air. So I think any fundraiser, any of us in this nonprofit space know how important it is to stay true to your mission. And so I think this really gives us that opportunity to keep that North Star for sure.
So then how do you go about your fundraising? Is it one-on-one? And you keep saying you've got a lean, mean machine there. So how many folks do you have helping you with that?
There's me and two others. So my director of programs, Megan, she Megan and I have over 20 years of combined experience under firsthand. So we really feel well versed in pediatric grant making. And so she's running our programs. Love Bags and individual grants, and then our organizational grants. And then we have a grant administrator. So Sarah is working with our individual families. So we are very lean. It's just us three. And so, it's a lot. Fundraising is a lot of one-on-one. I've been talking to a lot of folks, making a lot of phone calls, just trying to make sure people know that we're here and that we have a ambitious goal this year, again, to get $1.2 million out the door by the end of 2025. And then in 2026, we aim to grow our impact to over $3 million out the door. And so I want to make sure, that I have really articulated well to, the folks that are interested, that we do have lofty goals, and we'd love for you to join us, whether, it's being a donor or being a volunteer or just supporting us, liking our social media posts. All of it matters. And so I think, to really just make sure folks know we're back. We're back, and we're here to support children and families. And I also think, Ruth, I would be remiss to mention, if I didn't mention, I think the timing to, we expect lots of children to have their coverage changed. And we really want to make sure that we're able to meet the need. And so I think, the timing couldn't be better for us either.
How many applications do you get in, and what percentage are you able to grant that qualify?
Great question. So if you qualify, our goal is to fund you at some portion of your request. Okay. So while we can't meet every grant request at 100%, our goal is to get you over the hump. And so we also try to, we try to understand, and like I mentioned in the beginning, each individual case. So do you have the capacity to be put on a payment plan? So if you personally needed 5 pulpotomies and 3 cavities removed, would you have the ability, if the cost was, $2,000, would you have the ability to be put on a payment plan for $500 and we cover $1,500? And so that's why we really try to look at each individual case. Would the provider allow you to be on a payment plan? Do they require the payment upfront? What do you need to access the care? And that's really what we try to understand as we're working through the case, so we can present it to the committee and best advocate on behalf of that child and family. And so again, we try to fund, if you qualify, we try to fund you at some percent. Right now, we're able to fund heavily. We're, the first few cases that went out the door all got funded at 100%. Right now, I think we have about 40 cases in queue to be reviewed in August, but we expect them to keep coming in. And so, in the early days, right, we're funding at 100%. We anticipate as the demand goes up that we'll be funding probably between 60 and 75% is usually our goal. And the typical grants, when we were under the firsthand umbrella or under the Cerner umbrella, we were seeing about 1,000 grants a year. And so, Yeah. And so we really expect that to, our demand again to increase, and we'll shift our funding as we need to. And our committee is here to help us, to help guide us through how to allocate funds. And I also think it's a really compelling story when we aren't fully funding kids. And so just another way to engage donors in the important work that we're doing. And really helping donors understand, as we work through these cases, we hear the very personal stories, and so each grant that comes through is a very personal story with a child behind it who doesn't have the care that they need or deserve. And so helping donors understand that if they have the capacity to give, like it's their own child who needs help, then we can make a huge difference together.
I know you can't, because of confidentiality, tell us all the details, but are there any cases or grants in the last, old iteration, or let's even go with new, that stand out to you, that
absolutely
share your story?
There's so many, but I'll pick a couple. So one of the stories that gets me every time is we funded a little gal, this was a few years ago, who had Down syndrome, and her private insurance denied her speech therapy because Down syndrome is an exclusion in their policy. So her insurance didn't feel that she was worthy of speech therapy because she had Down syndrome. And so we were able to support this lovely family through their journey and get their little girl speech therapy and make her kindergarten ready. She deserves the care. And so we were able to support the family. And that story gets me every time, because that could be any one of us, right? And so I think that, that to me serves as a reminder that, we are doing important work. And then I'll tell you, the cases this month, our first cases out the door, they were super impactful. We had 2 little boys, 2 siblings, and they were in foster care, and their foster parents were not able to get them trauma-informed therapy. And they weren't progressing in regular therapy, and they needed a trauma-informed therapist, but their coverage, again, didn't include that specific type of therapy. And so we were able to provide therapy for these kids who need it. Like it's wild to me that, like they have to jump through so many hoops to make sure their children are okay. And so to be able to provide some trauma-informed therapy for these kids was huge. And then we purchased a therapy dog. A little girl who has autism, and she was eloping, and she was not able to regulate her emotions. And so they had purchased the dog, and we helped cover the training. So we know how to have a therapy dog, to have a service. It is a service dog. We don't cover like emotional support animals, but we do cover service dogs. And to have service dog training is extremely expensive. And you have to be, it's a privilege, I think. And so we want to take that out and make that accessible to everyone. And so we were able to get this little girl training for her therapy dog, which feels so important, like to be able to give someone the tools to be out in their community and experience life like you and I do every day. There's no bigger gift for me, right? This has been the biggest gift of my life. So I think, to do small things that people deserve it's meaningful work. And, that's why Megan and I have been doing it together for so long, and so thrilled to be back here with this new firsthand chapter.
Since you have worked with this first dependent, let's call it, and now independent foundation, and what you're doing, how has the landscape changed in terms of who you're serving and how you do it?
I think, I can say, a couple of things. When I first started at the foundation, we were receiving all of our case grant applications via fax. And so having an online application that makes it accessible for everyone, I think, you can fill it out from your phone. Our application is extremely collaborative. So the care team can fill out an application on the child's behalf and add the parent, so the parent can collaborate or sign and consent. But I think that's been huge because it really allows more folks to find us, right? To get the grant, to find us, to be out there. And then I think the other thing too is, I think part of the landscape that's changed when I started doing this work, I feel like I don't know if it was a misperception of my own, and I don't necessarily think it was, but I feel like we were seeing, a lot of kids who were on Medicaid and had a gap in care, or we were seeing a lot of international cases. And I think we have seen a shift over the last few years that, we're seeing just people with private insurance whose coverage isn't, getting them the care they need, or people with private insurance who have a gap, who can't meet their deductible, who can't use their private insurance.
Mm,
And so figuring out really like how to expand our services in order to meet people where they are so they can access the healthcare they deserve has really been the focus for us. And I think, under the corporate umbrella, we had a lot of, there was rules, there was red tape, there was a
right.
legacy of how things have been done. And I think this reignite, this next chapter has really given us the space to look at exactly what we're doing and figure out the best way to serve. Right? That's all we want to do is figure out the best way to serve others. And so before we weren't paying for deductibles. It wasn't a thing that we did. And now it doesn't, like, we sat down and we talked it through, and it's like, why are we putting up another roadblock for folks to access care? No, we don't want to pay insurance companies, but if that's what we need to do to get you the care that you need, so then you can continue to use your insurance throughout the
Right.
year. It just makes sense. And so being able to really sit down and examine every part of the grant application process and really see, hey, this feels like red tape. Let's remove this barrier. Let's remove this hurdle. And I think that's really been what we've spent a lot of time over the last year just examining and looking at, and really trying again to talk to our partners who are using the application and understanding what their roadblocks are, where their pain points are, and removing those, or, understanding from previous grant recipients, like, hey, what was your experience and how could we make it better? I think has really just been a gift that we've had the time, normally in fund, in nonprofit work, we're all wearing so many hats and we're just moving from one project to the next and just
Right.
trying to keep our heads up. Right. And I think having this gift of this last year to really re-examine where we are in the work that we're doing to ensure we can meet families where they are has really allowed us to serve in a different way.
What keeps you up at night?
I think this work is so important to me, and I feel like it's such an honor to be in this position. It's a legacy that I'm carrying forward for this family, but more importantly, the families that we serve need us so much. And so
Yes.
I think about like the fundraising, of course, and I think about the dollars, but I also I think about the families. I think about my own kids, and I think about just the work that we do is so important. And so to come here every day and be able to serve, or not to be able to serve, right? That's what keeps me up at night. Like,
Yeah.
what if we can't do this tomorrow? What if we don't do this next year? And so I think it's a big responsibility to be here and in this position. And it's one that I've been extremely honored to be in. But I will say that, and I think, again, with the shift in maybe some policies in healthcare, it keeps me up at night that kids won't get the care that they need, because if we're not giving people the healthcare they need, how can we expect people to be good learners, or how can we expect people to be contributing members? And so I think that, really starting at the bottom and ensuring they have every basic need met so that we can continue to build up this next generation, or these kids that deserve care, deserve education. I think, we're starting with the ground level. We want to make sure that they're clothed, fed, and healthcare. So I think
Right.
keeps me up, not being here and not being able to carry this forward. So
You did mention a little while ago, and I was very bad not to play up on it. There are volunteer opportunities now.
they're
So
all,
share with us the way, of course, you would like everybody to be a donor,
yes.
but how else can people help firsthand?
Absolutely. So, like you said, we'd like everyone to be a donor, but we also really want people to come in and volunteer. So, we are going to be working on our Love Bag program, like I said. So, we'll be stuffing bags of personal necessities. And we're really looking for some corporate partners too. Like, you want us to come and bring our care kit supplies to your company so you can all build care kits together. We would love to have that opportunity. And then we'll ship them straight to the organizations that are needing them most. And then we also have feminine hygiene kits. So if your listeners aren't aware, there are no government aid programs that cover period products. And so we want to make sure that our local area high school, middle school, elementary girls have the period products they need. So we'll be stuffing back little pouches of tampons and pads to give away to local schools. So that's another project that we would love volunteers. And then we always would love in-kind supplies. So care kit supplies, so in-kind donations, volunteer opportunities, come donate. And we are working on an event calendar. So we will be so excited to get our first fundraising events on the calendar and out to the Kansas City community for people to come and engage and meet the kids. We always love to have kids at our event that we've served. So, we'll be looking forward to sharing those dates and those fun events that we have kind of up our sleeve, planning away over here.
And best place to go is the website for information?
Yes. Yeah. You can reach out to us from the website. All of our grant programs are listed there. You can donate from there. Absolutely. So the best place to find us is firsthandfoundation.org.
Well, as we tell our audience, you're back. And look for that hand and in good hands, because you all have been doing this, even though it was secret for a little while. You can now share it with everybody. And Mollie, thank you for, sharing the journey that the foundation has taken, and now in your independent era, right?
That's right. That's right. Thanks so much for having me, Ruth. It's been a privilege to talk about the incredible work that we're doing here at First Hand. So thank you very much.
And thank you for joining us for KC Cares, Kansas City's nonprofit voice. We're produced by a nonprofit, Charitable Communications. And this KC Cares segment was brought to you by the Ewing Marion Huffman Foundation, www.huffman.org. If you want to be a guest on KC Cares, go visit our website. It's kccaresonline.org, and spread the love. Find us on Facebook and Twitter at KC Cares Radio, and on Instagram, we're at KC Cares Online. And don't forget, catch us on Saturday mornings at 8 a.m. on ESPN 1510 AM and 94.5 FM. Thank you for joining us on KC